Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by AACN's membership, offering members special discounts, clinical resources, and unlimited free CEs, with information on how to join available at www.aacn.org/discoverAACN. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to the Voices in Nursing podcast. This is Andrea Schmidt, a Clinical Practice Specialist with AACN, and I am joined by our co-host, Dr. Vicki Good, AACN's Chief Clinical Officer.
Thanks, Andrea. I'm super excited about today's topic.
Me too, because I think this is a topic that is not discussed as much as it should be. And our listeners, I think, are going to agree with this. So as nurses, we are really used to long shifts, and many of us suffer from sleepless nights. But what is really the impact of fatigue on us and the care that we provide? So today we're going to actually talk about how sleep shapes our well-being and our work. I know for me personally that sleep affects my mental clarity, my mental sharpness, and I feel like my reactions times are a little slower when I'm super tired. Vicki, how about you?
Oh, absolutely. And I started out working night shift and I loved night shift, but I will say between like 4 and 6 a.m., I was struggling to, stay awake. And then I worried about myself driving home. It's like because I lived in the Dallas-Fort Worth Metroplex and it took a long time to get home. So it's like I often wondered, how did I get in bed and I wonder, how did I make it from work to bed? And that's a little bit scary to think about that.
Yeah, you don't remember the drive home, right?
No, not at all. And as we researched this, we found that there's a lot of famous people that really practice and depend upon power naps and the benefit of them. I generally kind of laugh at my husband with power naps because I am not a napper, but after learning about this subject, I think I need to become a napper. So, Andrea, tell us more about our guests.
Well, we are very fortunate that we have two individuals, Dr. Sue Weaver and Dr. Terri Wurmser. They have both studied the impact of sleep and fatigue on nursing, which I think is something that really needs to be done. And based on their research, they found that there are some important warnings and really recommendations regarding napping for nurses. And I think hospitals and healthcare systems really need to understand the benefits of it. Oftentimes, you get in trouble if you take a nap, even if it's on your break. And I think that maybe we need to switch our thinking and think a little bit about allowing nurses to do little power napping while they're at work. So let's start out with some introductions. So Sue, would you like to tell us a little bit about yourself?
Certainly. Well, thank you, Andrea and Vicki. You set a great stage for our conversation. And I'm happy to talk about, this is now my favorite topic, to talk about nurse fatigue. So I'm a nurse scientist at Hackensack Meridian Health, which is a large healthcare system in New Jersey, and also the State Workforce Center, the New Jersey Collaborating Center for Nursing. And so I started my research career examining the administrative supervisor or house supervisor role with a focus mostly on those working night shift. And then after doing that research and also working with many of our night councils at our hospitals, I really became interested in what we can do to improve the work environment on night shift. And the first thing I did was conduct a qualitative systematic review through the Joanna Briggs Institute on the experiences and perceptions of nurses working night shift. And that study really opened my eyes. And I just want to share with you some of the quotes that nurses or the findings that some of these studies informed us about. And this was the first time I was hearing this. So maybe I was naive, I don't know. But nurses reported instances of falling asleep while driving home and waking up a few lanes over while on the parkway. Others admitted to falling asleep at the red light and waking up at the light when the person behind them had to get out their car to bang on their window. That really struck
Mm.
me because I was a evening shift nurse and I only worked nights when I had to, like snowstorms and that sort of thing. And another nurse said when horns were honking, that woke her up at the traffic light. So those findings were from studies conducted not just in the US, throughout the world. So it wasn't just a US issue. So from this, it led me to doing this study on nurse fatigue at our organization. And I've since become very passionate about informing nurses and working hard to improve things for nurses regarding fatigue.
Well, that's some great work and definitely some frightening insights that I definitely think need to be addressed. And I look forward to hearing about your work as we progress through today's podcast. And so, Terri, how about you tell us a little bit about yourself?
Sure. So I'm Terri Wurmser, and I am the Vice President for Nursing Research, Grants, and Academic Affairs at a large hospital system in New Jersey. And I'm also the Dean of a nursing program where we have a traditional BSN program, an accelerated program, and a direct entry master's program. I've been with the organization for over 25 years and have worked a lot on the work environment for our nurses. That's been a lot of many of the grants that I've received. And I work very closely with Sue, and I can tell you she is very passionate about this topic.
Well, and I became even more interested in this. I've done a significant amount of work in the patient safety arena, and looking at those negative consequences of fatigue is not only impacts the nurses, but also impacts the patients that we serve. So can you both talk a little bit about those negative consequences of fatigue on healthcare workers and their patients?
We did this study on nurse fatigue, but quite frankly, there's been decades of research on nurse fatigue, yet it hasn't been brought to the forefront enough like other topics, like thankfully workplace violence now is being brought to the forefront, but nurse fatigue is still not being discussed enough, in my opinion. So the consequences, I want to start with talking about the consequences on nurses. In our study, day and night shift nurses reported falling asleep at a red light, missing their exit or their turn, and even having a car accident or near miss. And in doing this work, I never expected so many nurses to come up to me and tell me about their accident. It almost seemed like a rite of passage to nights. And I just want to share one story. And this happened during our survey that we were doing. It was, and a nurse came forward and shared this with me. I guess after her accident, then she answered our survey. But she was new to night shift, and she's a new graduate nurse, and she'd been working a month and a half on nights. And so she tried to work 2 night shifts in a row and unfortunately had a car accident on her way home. And she said she never fell asleep before driving. She would drive her kids, be the mom who would pick up kids late at night. She never felt that this would happen to her. She felt dizzy. That was she didn't feel overly tired. She just felt dizzy. And when she was 7 minutes from home, she must have blanked out. She hit a sign and went into the opposite side of traffic. And then she says God righted her. And she feels lucky to be here and recommends, because no one ever thinks that this will happen to her, to happen to them. And especially who's working nights, those new graduate nurses who are working nights. So she talks about how it's important for us to educate nurses who are new to nights about drowsy driving and what they can do to prevent drowsy driving. Probably the best thing to do is to have somebody pick you up, if you can't get enough sleep, if you're that tired. And then, for patients, the other consequences, there's, like I said, decades of research showing, and just like you described in the beginning, Andrea, how you just like don't feel like you're reacting fast enough. There are consequences and errors that can happen. Even studies are reporting the errors that happen. Nurses on nights in our qualitative systematic review even talked about workarounds that they do to double check to make sure, because they know they're feeling very tired.
Mm.
And so they're doing things like asking a colleague, here, please check this with me. I know I'm tired.
Well, the nurse that you talked about was one of my graduates, so I really felt badly about that from our program when I heard that she, was in that accident. But I know when I've talked to some nurses, what they've described is that it feels like they're in a constant state of exhaustion with the work that they do. Their focus slips. It takes more effort for them to concentrate, and that can really increase, as Sue said, their risk of making errors. And some of them feel like they're just going through the motions instead of really feeling fully present with their patients. So it can have a lot of, quite a bit of impact on patient care.
One thing that really boggles my mind is that, all of this is out there, and to hear you say, we're not acting on it. And it's very frightening that we're putting nurses in this position, to not have any sort of a little power nap or cat nap, feel like it's a safe thing to do, I think is maybe something hopefully that we should be able to work on as this becomes more known, and maybe more hospitals, follow by example of one hospital starts a process. So I thank you both for your work. I think it's very fascinating. One thing I was thinking about, so in your research, you found that the fatigue doesn't always just affect the night shift nurses, that it's also affecting the day shift nurses. So is this, lack of sleep, or are there other factors that are contributing to this fatigue?
Yes, there's so many factors that contribute to the fatigue. And as you mentioned, I was surprised in our study that the day shift nurses had poor sleep quality, just like the night shift nurses. We use the Pittsburgh Sleep Quality Index, and those creators say 5 or greater is poor sleep quality. And I'm not exact with these numbers, but roughly day shift nurses scored an average of 7 in poor sleep quality, whereas I think it was 9 for the night shift nurses. So both had poor sleep quality. And so many factors contribute to that fatigue. I think not taking breaks on our shift contributes. The long work hours, the 12-hour shifts aren't 12 hours, right? They're, till you get out of there, it's 13 hours. The scheduling, sometimes the schedules that nurses work or the schedules that they choose potentiate the fatigue. And then also the personal life, the family responsibilities. I think the thing nurses need to do, number one, is to prioritize their self-care, their well-being, and prioritize sleep. And one nurse told me this, and I think this is a great example. She worked nights, sleeping during the day is not the same as sleeping at night. And she was like, you know what? I'm going to sleep and I'm going to get up at 3 p.m. and go grocery shopping. And she said, hey, do day nurses say, I'm going to get up at 3 a.m. and go grocery shopping? She said, no, they don't say that. I'm going back to sleep.
Yeah.
And I thought that's a good example. Night nurses need to think like that we have to prioritize our sleep. The grocery shopping will get done. But, if you wake yourself up early, then that's going to potentiate your fatigue.
I also was thinking about two other things. One is lack of food, if they're not able to get a break, maybe lack of liquids, right? Sugar. And then the other thing is, I think a lot of people, especially night shift, and I can attest to this because my sister worked night shift for 20 years, not going home. And then, you have a child at home, a young child, and now that child is awake. And so if you're not feeling guilty about saying, no, I have to put this child in daycare so I can sleep, And so she quickly learned, you know what, I can't watch the child after being up all night. I can't feel guilty about putting him in daycare. And she wound up doing that so she could sleep. Then when she was awake, she would go pick him up. And so I'm sure she's not the only one who felt like that.
Yeah, you're
Yeah.
exactly right. That came out in the qualitative systematic review. Many nurses talked about that guilt feeling. My mother-in-law's watching my kids. I should be watching my children. You know, uh, that's why I'm working nights, so I don't have to put my children in daycare. But, it's your health and well-being. You have to sleep. You
Hmm.
can't sacrifice your sleep.
I had the opportunity to walk in one of our nurses' shoes not too long ago, and it was a day nurse, a day shift nurse, who was really an excellent nurse. And so I was with her for 12 hours, and I remember saying to her, "When are we going to take our break?" And she said, I don't usually take a break. I'll go and just, grab a sandwich. But, the cognitive load, and they're bombarded with alarms and technology updates and all these competing priorities. Keeping track is just mentally exhausting. And what she said to me, I'll never forget, at the end of the shift, she said, "Sometimes I can't even talk, to give a report. I just can't even think." So there's a lot going on during the day as well as night.
That takes me back to a cartoon that I used to use in presentations when I was doing patient safety presentations, because there's a lot of data on the impact of breaks on brain power and being able to kind of reset yourself. And it's two janitorial staff standing outside of a break room, and it says break room on it, and one janitor says the others, "So who goes in there?" Or, "What is that room?" And the other one says, "I don't know. I've never seen anyone in there." So it is true. I mean, I think we all think, "Oh, we're not going to take a break today because we're going to get more done." And we're actually more productive if we take that break. So that transitions us to really my next question is, how do we turn this into action? What do we need to do to write this? And first, I want to focus on what are some things that organizations can do to address and counteract the issues of fatigue?
First thing that I think they can do is really recognize that fatigue is a safety issue. Like in the aviation industry and so many other, the trucking industry, they mandate naps and that people take a break. I mean, we have breaks scheduled, but very, very rarely can nurses take a break, I think, anymore. So it's not a personal failing. Staffing levels need to be realistic, making sure schedules are designed to allow really for true rest, avoiding back-to-back shifts. Many of our nurses want to do 4 shifts in a row so they can get the rest of their time off. That is really exhausting. So some hospitals have started providing quiet spaces for rest breaks. Few, I don't think we have many, but they have provided nap rooms, and they built education into orientation and ongoing training. So those are some of the things that I think organizations can do.
I think it's tough when you have the nurse who the unit is positive and wants to encourage them to take a break and give up your phone and go on your break. Somebody will cover, and they're like, "Oh, no, no, I have to have my phone." Like they just can't disconnect because they want to be the one to take the call instead of trusting that their coworker can do it. And it's like we have to overcome, I think, some of that in order to make it to the next step of truly having a break and truly having, that time away from the bedside.
And I think sometimes busyness is we nurses wear it as a badge of honor, and I think some older nurses, I took care of so many patients, during when I was younger, and I think we really need to, take a look at our younger nurses, and they are, I believe, more, you know, um, responsive to being more in balance. And I think we should really, take a look at the way they feel about it, not make them feel guilty.
I agree. I say often, sometimes people will say, oh, the younger generation doesn't do this or doesn't do that. But then I say, why aren't we learning from them? Because they do set those boundaries and, um, I think they do a better job, quite frankly, in taking care of themselves sometimes.
I agree with that, Vicki. I really do. And I think unfortunately, some of the more seasoned nurses are, well, because I worked and it was so busy and I didn't take a break, but the acuity also may not have been as high 40 years ago as it is right now, too. I mean, there are differences. Life is different. You could unplug before and now we can't, or we don't. Let's put it that way. So I think there's a lot of factors, which actually brings me to my next question. So you've told us how an organization should respond, but as the nurse, what can the nurse do to bring this to the forefront of an organization who maybe isn't supporting some of these things, or what can the nurse do to take care of herself? So like either one.
I think that, we really have to work with our nurses to prioritize sleep hygiene, things like creating a dark, cool, quiet space for rest, avoiding caffeine too close to bedtime, um, even if their sleep hours are unconventional. I think they can take micro rests during their shift, actually taking the full meal break that they have coming to them, or thinking about short mindfulness and breathing exercises to reset themselves. And sometimes nurses need to be able to say, I'm tired, I need a quick reset. And we need to respect that, right? We need to allow them, if somebody's overwhelmed, we need to take care of each other. We need to improve teamwork, I think, on the units as well.
And if I could add, I think another thing nurses could do at their organizations is if they don't have night councils, advocate for night councils, because there you can collaborate with other night nurses, maybe bring in a speaker, talk about, rest and the value of napping, and Andrea, I think you mentioned before about food, food is important for those working nights. And maybe I know many hospitals throughout the US have very, very limited food available for those working nights. Vending machines that have unhealthy food, that's not what they should be. That's going to make their fatigue worse if you're eating unhealthy. But what are your options if people say, well, why don't they pack something? Well, they're tired, and that's the last thing you want to do before you go to work when you're tired is to pack yourself a healthy lunch. So I think night councils can be a real good resource for those working nights in particular.
What can we do as nurses to, encourage hospitals to maybe rethink their positions and policies on no sleep? Because there are some that have that, even on your break, it's like you're not allowed to do what you want to do on your own break. How do we kind of work around some of that? We're getting buy-in.
Well, we're starting to move the needle a little bit in New Jersey, I think. We presented our results at the Organization of Nurse Leaders has nursing work environment staffing councils, NWESC we call them. No, it's a mouthful. But more than 65% of the hospitals in New Jersey have NWESC councils. And we presented these results to them. Some of them didn't have night councils, so they implemented night councils, and now quite a few of them are starting to work on implementing napping. And one has already, it's a standalone hospital, not a large healthcare system, has implemented napping. So I feel like we're starting a little bit in New Jersey to move that.
My curiosity is what kind of barriers are they facing? Because ANA and Joint Commission both have said and issued statements regarding healthcare worker fatigue. But it's always interesting to me that we have evidence. We say we're an evidence-based practice organization, But then if we don't like what the evidence says, we don't necessarily get it implemented. So what kind of barriers are we seeing with the implementation of some of these best practices?
Well, before I answer your question, I want to share that the American Nurses Association is updating their position statement. I'm working with them on that, so I'm really excited about that. And I think I would like to see nursing organizations join together and address this issue of fatigue. Maybe AACN will make it a strategic priority also. But the barriers, from my perspective, are, legal concerns. Many hospitals have HR policy that say no sleeping on the job. I
Mhm.
think there's fear that, you know, patients and visitors are going to see nurses asleep at the nurses station, like in front of the monitors. Uh, I think, and this has been documented in other research studies. They weren't successful with napping because of the lack of leadership or support. Nurse manager didn't support the nurses taking naps. And then there's a real estate problem in hospitals. It's hard to find those rooms for nurses to take naps. And nurses tell me, yeah, I just wanted to sit quietly in the break room, but my colleague came in, the lights go on automatically. So they really need a space to take that rest.
Yeah, I agree. I don't think anybody's looking to snooze at the nurse's station. I think, when you're on your break, my personal feeling is I should be able to do what I want to do. If I wanted to go to my car on my break and close my eyes for 15 minutes, I should be able to, right? So to me, your break is your break. But yeah, it's just going to be an uphill climb, but maybe we'll get there with all of this work. And I think that there are some hospitals that are having some success. In fact, the Children's Hospital in DC and Mission Hospital in Mission Viejo, California, I heard they've had some success doing some implementation. Can you describe maybe some of the steps that they took to implement their program and the key results? Because maybe others, our listeners, could learn from this and take away some of the information back to their leaders.
You can get Dr. Geiger Brown's article. It was published in October of 2021. It's called Going Beyond Position Statements, One Hospital's Successful Initiative to Implement Napping for Night Shift Nurses. And like I said, this was at Children's Hospital. And their first step was doing a literature review, which really supported the implementation of napping. So the VP of nursing, based her decision on implementing napping based on that literature review. And also they did a pre-implementation survey of their nurses, and they found 91% of the nurses had frequent drowsy driving experiences. And more than half of the nurses nodded off or fell asleep at least once per month while at work. And so that was the impetus that supported the VP of Nursing's decision to implement napping. And the initiative allows night nurses to take a brief 30 minutes or less planned nap at a unit designated location before 4 a.m. And night shift naps were successful in 10 out of the 14 units, and 82% of the nurses felt refreshed by the brief nap and felt safer driving home. And I know I had a conversation with leaders at Children's, so if nurses are interested in learning more, they're very welcoming to share their work, read their articles, and they're very want to be supportive of this. It takes time to implement this because if nurses aren't taking breaks, you're going to have a hard time implementing napping. So you need to work on, taking breaks and finding a space for that nap. But I'll let Terri share with you about Mission.
Sure. So Mission took a little bit of a different way to handle it, and they did provide a manuscript on to nap and not to nap, which was in the American Nurse Journal by Diana Drake and Monica Malkoot. And so They focused on fatigue education and structured rest breaks. First, they trained both nurses and managers on recognizing fatigue and built in protected time during the shift for breaks. They started with having nurses take the fatigue modules, which I didn't even know about until reading this article, developed during the pandemic by NIOSH. Then they set up a study and developed a planned nap protocol, which is in their article, on a unit, concentrating on the logistics to make sure nurses had a place to nap. The protocol included 30-minute rest period with 20 minutes of rest followed by 10 minutes to recover and to return to work. And nurses had the opportunity to actually be part of the study or not. And what they found is that fewer people who did take the nap reported fewer near misses, better nurse morale, and even improved patient satisfaction scores because the rested nurses could provide more attentive and compassionate care. I think that both of these examples show us that when organizations really take fatigue seriously and give nurses permission and resources to rest, that really everybody wins, nurses, patients, and the hospital as a whole.
Well, thank you for outlining those because I think it's great to hear from our colleagues that are having success and get some ideas on how we can implement in our own environment. So I greatly appreciate those references, and it makes my head start spinning as the CCO of, what other resources can we provide our community to support them in this effort. But as someone that works in the patient safety or worked in the patient safety arena for quite some time, I want to applaud you all for the work you've done in bringing this critical issue to light. And also want to just thank you for spending this time with us. I know time is a precious commodity for all of us, and I greatly appreciate both of you joining us today.
Well, thank you.
Yeah, thank you very much.
Honored to be here, and I hope we can have more conversations about nurse fatigue.
Yeah, it sounds like there's several more that we need to have. So thank you so much for sharing your time today. And to all of our listeners, we want to thank you as well for being here. And we would love your feedback on this episode and any other ideas that you might have for future episodes. You can reach us at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's membership, offering members special discounts, clinical resources, and unlimited free CEs, with information on how to join available at www.aacn.org/discoverAACN.